Thank you for joining us today on Health Matters. I'm Dr. Mark Castellaw. Our program today is about primary care medicine, and one of the subjects we want to talk about is diabetes. Over 20 million people in the United States suffer from diabetes. And so this is a real epidemic in the country as well as in the Mid-South. We're a real hotbed for type 2 diabetes. Our next guest is Dr. Greg Jenkins. He's a Baptist Medical Group internal medicine doctor, and we're going to ask him some questions about diabetes. Welcome, Dr. Jenkins.
Thank you.
Now, oftentimes patients have symptoms of diabetes, and what are some of the typical symptoms that you see?
Sometimes folks will present with no symptom at all, and until they've had their blood sugar checked, they don't even know they have diabetes. But some of the common symptoms are excessive thirst, going to the bathroom a lot, sometimes losing weight without trying. And they're usually happy about that until they find out that they have diabetes. So those are the most common ones.
Now, diabetes is epidemic in the Mid-South area and actually throughout the country. What do you think some of the reasons are for that?
Probably lifestyle has more to do with it than anything else. As obesity has increased in our country, more than 60% of us being obese, type 2 diabetes is largely related to weight. So I think that's one of them. Another one is inactivity. Most Americans are exercising less and using the modern conveniences more.
All right. Now, what's the difference? You just mentioned type 2 diabetes. What's the difference between type 1 and type 2 diabetes?
It's interesting. It's somewhat different from most other things in medicine. Type 1 shows up early in life, usually in childhood or adolescence. And type 1 is really an immune response where you develop antibodies to the cells in the pancreas that make insulin. So those individuals require insulin to live. Type 2 diabetes, on the other hand, develops later in life, typically after age 40, although that line is blurring now with the increased obesity that we talked about. Type 2 diabetes is more a problem of insulin resistance, where you're making the insulin, your body just doesn't respond to it as it should, or the cells in the pancreas are not making insulin properly. So we try to get folks to improve that response to their own insulin, and that's really what type 2 is a problem of insulin response. And most diabetes in our country is type 2, probably 90+%, maybe 85, is type 2 diabetes.
Well, last month here on Health Matters, we had a complete show about diabetes. We had Dr. Jay Cohen here, an endocrinologist with BMG. And he presented diabetes from his perspective, but as far as primary care goes, what are some of the things that a primary care doctor sees with people that may or may not know they have diabetes, or how that you initially approach it?
Well, information about diabetes is out there. Of course, no one wants it. No one wants to hear that they have diabetes. So you have to be careful at how you approach them at first about that. But always you want to start with things that they can do. Most folks are afraid of the shot and they don't want to take insulin. So it's important to start out with the lifestyle issues and talk to them about getting their weight down and exercising and those sorts of things. But as it is with primary care, you develop a relationship with these folks over time, and every time they come in, you give them a bit more of the puzzle of diabetes and try to teach them every time they come in something new about diabetes and how to manage it themselves.
And it's really a joint effort with diabetes. It's not just all the patient's got to do this, or the doctor's got to give you this medicine or give you that medicine. It's a joint effort of working as a team to try to control this illness.
Absolutely. I tell my patients all the time, you're the one who manages your diabetes. I'm simply your coach. I try to get everyone into a diabetic education program, and I always send them to the American Diabetes Association's website so that they can learn about diabetes and we can have those ongoing discussions. But it is important that the patient engage and understand they're the ones who manage their diabetes.
Well, thank you so much for being with us today, Dr. Jenkins. This is Dr. Mark Castellaw with Health Matters. Now, coming up next, we're going to talk about one of the most important things you can do for your good health.